Well, time is ticking down on summer and students are getting ready to head back to class, which means for many households a shift in routines. Dominique O'Neill joins us in studio. Dom, what can families do here?
Well, Kaylee, I learned that teachers can play a role in helping to notice if a student needs extra help or is struggling. Experts I talked to say it's imperative that parents make sure to be in communication with their kid's teacher about behavior if they notice any changes. For parents that have kids going back to school, it can be stressful. But when you add ADHD to it, it can make it even more challenging.
Whether or not that's with hyperactivity or with impulsivity or with inattention, they have different subgroups. But when you do that with the help of your teacher, the help of your daycare center, and the help of your physician or primary care provider, that's how you come up with the diagnosis of ADHD.
Some kids that have ADHD tend to struggle with school performance. Dr. Robert Mills is Chief Medical Officer at Nationwide Children's Hospital Toledo and also a former pediatrician. He says there are some lifestyle and potential behavioral modifications that parents can use to help their kids by using positive reinforcement, reducing distractions, and encouraging physical activity and providing regular feedback.
And so good dialogue back and forth between either the daycare or the school can help with their input to say, this is where your child is potentially having some issues that may be affecting or impacting their learning.
The challenge in some cases is that teachers are seeing some noticeable differences in kids' behavior who are taking their meds regularly versus not. Director of Student Services for Washington Local Schools says, generally speaking, for parents or caregivers, if they do suspect that there may be suspicion of ADHD or something like that, they should talk to their son or daughter's teacher and get their feedback.
I think we see a more structured routine at schools, so I think sometimes when students struggle to pay attention or obtain to a task, that can be more noticeable in a group full of students when they don't have the one-on-one attention that they would have at home.
And Dr. Mills says the last several months, the supply chain seems to be getting better. So getting those medications and the availability of those have definitely improved in the last 4 to 6 months. Reporting in studio, Dominique O'Neill, WTOL 11.